Before we start today's episode, we wanted to send a couple shout outs. The first one is to Michelle Persico and family. A couple days after we recorded with her, she welcomed beautiful twin girls. So congratulations to mom, dad, and brother. Another shout out to our very own Oneida Wands and family. They had a successful move out to Florida. We are so happy for you. We know that you'll all do wonderful and amazing things out there. Of course, we miss you, but so happy for you. And a huge shout out to all of our listeners. We just love you all. We thank you so much for the support, all the messages, all of the emails. We feel so blessed to be doing this. So we thank you. And we hope you enjoyed this next episode. We are Christina,
Oneida,
Alicia,
Colleen.
Welcome to FAANP's podcast.
This is a podcast by 4NPs. 4NPs, advanced practice nurses, students, and anyone interested in the medical arts.
That's the number 4 NPS podcast.
If you have a topic you'd like to see covered, please feel free to email us at 4npspodcast@gmail.com or reach out to us through our social media.
Hi everyone, hope you are enjoying your week. We have an amazing episode that we are so excited to share with you. For this episode, we had the opportunity to speak with Dr. Stephen Ferrara. He is an actively practicing family nurse practitioner, executive, and faculty member. He combines years of clinical experience along with health policy development to increase access to nurse practitioner partnered care in New York State by serving as executive director of the Nurse Practitioner Association, New York State. He is Associate Dean of Clinical Affairs and Associate Professor at Columbia University's School of Nursing, where he leads the nurse practitioner, primary care faculty practice, and clinical stimulation. He also serves as the Executive Director of Jonas Nursing and Veterans Healthcare and is the Region 2 American Association of Nurse Practitioners Director, which includes Puerto Rico, New Jersey, and New York. Dr. Ferrara has received many awards for his health policy work, with his most recent being inducted as a fellow into the American Academy of Nursing in 2020. It was such a pleasure to speak with Dr. Stephen Ferrara. We learned so much. He is such a strong advocate for all nurse practitioners, and we hope that you enjoy the episode. Hi, Stephen. Thank you so much for joining us on our podcast. We can't wait to hear all about your nursing journey.
Thank you so much for having me. I'm looking forward to this.
Great.
So what made you decide to become a nurse practitioner, and what has your journey been like so far?
So I didn't decide to be a nurse practitioner very early on. It was something that I was not aware of as I was growing up. I had always had the thought of going into sciences and wanting to biology was my favorite subject. So what do you do when you like biology? Well, I thought about, the healthcare professions, and I thought, maybe I could do something in that space. So I had gone to college actually as a biology major and a chemistry minor, and didn't really know what I wanted to do. Again, was exploring all different options. I looked at medicine, I looked at nursing and physical therapy and pharmacy. And then I found myself graduating college and not really still having a plan. So at that point, I do credit my aunt, who is a nurse and was always suggesting the nursing field, which again, as a non-healthcare person at that time, I really didn't understand or know what a nurse was or what nurse practitioners did. So I got a job as a medical assistant. And said, if I'm going to go into healthcare field, let me at least experience it a little bit. And I did, and I really liked it. At the same time, I became an emergency medical technician, and I had volunteered at the local ambulance and really enjoyed my interactions with patients and working with colleagues. And at that point, I had decided to go to nursing school. And I did do an accelerated program where I got my BSN in 1 year since I had all the science prerequisites. I was out of school about 2 years at that point, and I was able to do my bachelor's in 1 year, an intense year. After that, I did work as a med-surg nurse on an orthopedic floor, which was a interesting experience. I always never really thought that the hospital environment was for me, and that experience solidified that for me. And I did decide to go back and become a family nurse practitioner at that point. And it's just been, that's 22 years ago. It's hard to believe that it's been that long for me. And, I knew that the idea of the primary care nurse practitioner, it resonated so much with me. To be able to make decisions with patients, prescribe medications, evidence-based treatment. These were the conversations and the interactions that I wanted to have with my patients. And I was fortunate to find that spot for me.
That's great.
Wonderful. Yeah.
I identify with your journey. My journey is similar to yours in some ways. Of course, I'm not doing as many things as you do, though.
Yeah, I have to find a way to scale down a bit, but it's all good. And as we get into it, you'll see that a lot of my world overlaps. So it all makes sense.
So Stephen, this is Oneida here. Great story. What were some of the obstacles that you encountered along the way? I'm sure there were many. If you could, share with us a few of those.
Yeah. So I was the first in my family. My parents did not go to college, so I was the first one to attend college. So that was a different experience. And I did commute to school, and I worked, not full time, but I worked as I was going to college. So that was certainly a stressor and a challenge at the time. And then, once getting into nursing school, there were not many male colleagues in my classes, and which I never thought was a problem. I mean, I knew I was going into a profession that had majority female in the profession, but I did have some challenges because it was hard to relate to certain things. I had no sort of mentor to necessarily look up to, a role model to look up to. So that was a challenge. And then I don't necessarily like to, make an issue of male and female. That's not a thing that I want to have hanging over anyone. But, there was the perception, being a male nurse, and I hate that term, but I'm going to use it for our purposes today, that patients' assumptions was that I was a physician or I was a medical student. And I would say I'm a nurse or I'm a nurse practitioner student, and patients would, or colleagues even, non-medical friends would say, well, do you go to medical school after that? And I said, no, I don't go to medical school after that. I do this, either, nursing or a nurse practitioner. Right. So that was a little bit of a challenge in that I was happy with the decision I made to be a nurse and ultimately a nurse practitioner. But it was a perception that was, not so inherent in people. So that was, a little challenge that I had. And it certainly didn't keep me up at night, right. But it was something that I encountered repeatedly over the years. From there, the other challenges were, as many students in school, I had to take out loans for my master's and ultimately my doctoral education. And that's always a strain. And you wonder if, you're going to be able to pay this back. Is it going to be worth it in the end? I'm happy to say on this side, it was for me, absolutely. But it was certainly a struggle at the time.
Well, thank you for sharing that. I know it's probably I'm glad you said it, because actually my thought was you're in a female dominated field and how was your perception or your support systems being a male nurse, and you just expressing you didn't have many role models, but now you're in a position to actually kind of flip that script a little bit and be a role model yourself and kind of pave a way for other males in the field or in nursing or going into advanced practice. So that's awesome. I did want to ask, how was your transition as a staff nurse in your RN role to transitioning into advanced practice, into family practice? How did you manage that? And being your limited access to mentors, how did you make your way through that?
Yeah. So I had, in my mind, decided I wanted to be a nurse practitioner. So the time that I was there as a floor nurse, and it was a heavy orthopedic med-surg floor. So I knew in the back of my mind that, was not something I wanted to do long term. So it was really keeping my eye on, what my goal was. And that was being a nurse practitioner. And, that is not in any way to minimize the work and skills of the other med-surg orthopedic nurses or any other nurses in hospitals. But that was just not something that really sounded so enticing to me.
Sure.
So the transition was not so difficult for me. I did have experience. I think at that point I had about 4 or 5 years experience as an EMT, and being around medical professionals or paraprofessionals and, sort of understood where I wanted to go. And I wasn't sure how I'd get there, but I knew where I wanted to go.
Mm-hmm.
And that really helped me. But as I was, pretty much concurrent in school, it made me super aware and super focused on the patients I was caring for as a nurse,
Mm-hmm.
as an RN, and trying to think of what would I do as a nurse practitioner if this patient was in front of me. So,
Wow.
I that's what I used going forward. And yeah, there weren't a lot of mentors or role models for me as a male nurse practitioner or a male nurse practitioner student. And, it was interesting that I've believed over time that there was a hesitancy for my female colleagues to sort of embrace me as a colleague.
Wow.
Whether they thought I guess it's perception is what is key, but I never intended to come across as a know-it-all or, I have it all under control. But I think there was perhaps that perception, and colleagues sort of said, well, he got it. He's on his own, and, he can do his own thing. But that was hard for me.
Yeah.
It was hard for me because wanting to be a nurse practitioner, I really didn't have that mentorship and that experience and that person to say, okay, this is what we should do in this situation. Of course, I had friends and colleagues that would help me from a clinical perspective, but not as a professional, not as someone coming into the profession. So that was something that I really missed. And Alicia, it's right. I really try to be hyper aware of that now and offer mentorship to those looking to get in the field or those who are, already in the field. I'm happy to be able to speak with them and just kind of try and problem solve a little bit.
That's really great, because it's kind of like you didn't forget where you came from. Because I find I'm surprised at so many nurses, male or female, aside from that just don't offer that support and don't offer that mentorship and don't, it's like, as we go into it, we know what we needed, and it's so awesome that you kind of can now, see the need and be available and make that change that you wish you had. And I think a lot of they don't do that, and so that's really awesome.
Thank you.
And I think even from our perspective, I mean, okay, we're females, but we also lacked that mentorship and just the transition into advanced practice as well. Like it's something that's missing, and we'd love to kind of be somewhere in the field of making a change for that, or advocating that it's necessary, and we need to be kind to one another, and we need to offer, others to kind of learn from our experiences and make the field better, because I think kind of sometimes we do a poor job of supporting those coming up under us.
Yeah.
So I think that's kind of awesome that you're in a position to do that. And thank you.
Thank you. Yeah. Unfortunately, it is pervasive in our profession, right?
Yeah.
We've heard the terms lateral violence
Mm-hmm.
and nurses eating their young. And I am not going to opine on why that is or why that is the case, but it is true. I'm sure many of us have experienced those situations.
For sure.
Working as a novice. And it's hard, and it shouldn't be that way. The job we have is so difficult.
Mm-hmm.
We don't need our colleagues working against us to do the job that we're trying to do.
It's so true.
People are incredibly complex beings, and no one can possibly know everything. And if you don't have the support of the person that's at your side, it's just makes it so much harder to get anything done.
Yeah.
That's so true.
That's absolutely right.
And Stephen, I know this is Colleen. Hi.
Hi, Colleen.
Hi. I know you wear so many hats, and that's one of the things I really admire about you. That's something that at my core, I really have always loved about nursing. I didn't know about that when I first got into it myself. But as I met people along the way, I realized that this is one of those professions that there are just so many directions to go and there's so many things to do and you can be involved on so many levels. So you are one of those people who is involved on many, many levels. And I'm just curious to know, do you have a favorite hat that you wear or something that you just really love to do? Like if you had to whittle it down because you were involved in too many things and you thought to yourself, oh, I have to cut one thing. What's the one thing you would not cut at all?
That's a really good question, Colleen. I alluded to earlier that, a lot of my worlds have this overlapping sort of circles, concentric circles, right? So, what I really enjoy is the health policy and advocacy piece that I do. And I will be honest, I did not intend to do this as a nurse practitioner, right? I thought I would be clinically as a nurse practitioner, maybe, become more involved in some leadership positions, but, never as, an executive director of a state Nurse Practitioner Association, never really getting involved with the National Association at the board level. And, I've learned over the years, and it started out way back when blogs were a thing. I started a blog, right? Because all I would see were opinions from physicians. And there was no nurse practitioner. There were very few nurse practitioner voices that were out there. And I said, I'm going to start a blog. And, what did I know at the time? But, I titled it A Nurse Practitioner's View. And, it was my way, to say, okay, I am, maybe nobody's reading this, but at least I am putting my thoughts out there for the world to see. And, this is pre-Twitter, this is pre-Instagram. So, that was my method of really getting involved. And then things sort of, took off from there. And, I was able to get more involved in the health policy discussions because it was something that, as a nurse practitioner, I didn't understand that there were different rules and different laws in different states that really affected the practice of a nurse practitioner. And I said, how does that make any sense? How does a nurse practitioner who, say, is educated and goes to school in New York and has a certain, scope of practice and decides to move to another state, and what they were doing a week ago in one state, now they can't do in another. Or conversely, now they can do something even more. So that really piqued my interest and said, this doesn't make any sense. As RNs, we have a scope of practice that is pretty recognized across the United States.
Right.
But as nurse practitioners, it really depends on the state that you're licensed in. So that is my passion, is trying to have lawmakers and stakeholders and anyone else who will listen to understand that, nurse practitioners are educated and prepared to deliver the care that, in our specialties, family, adult, mental health, et cetera. And there shouldn't be an arbitrary restriction to that practice. And we know from different states that there are many arbitrary barriers that exist. So it is my health policy hat that I love to wear, speaking with legislators, speaking with colleagues, and trying to encourage them to get involved and to reach out to their lawmaker, because they'll listen to their, constituent rather than listening to me. So those are the things that I'm most passionate about, and I'm happy to be able to continue to do that work.
That's so wonderful. As nurses, we're advocates for our patients, but it's nice that there's people out there who are advocating for us as practitioners. And you have a really great opportunity here to make a significant impact on the profession. And it's just So great to see somebody with such passion kind of leading that.
Thank you.
Appreciate it.
Yeah.
Thank you.
So, Stephen, why did you initially decide to join the NPA, and at what point did you become the executive director?
So I joined because I thought I needed to be a member of this organization. I remember as a student, spoke to a member and they said, "Oh, you have to join this organization." And I said, "Okay." So I joined as a student. And I will admit, like many people, I joined and didn't know why I did, and kind of went on trying to be a successful nurse practitioner doing clinical work for my patients, right? Mm-hmm. Still being a member somewhere. And so I was not active for probably a handful of years. And then I happened to see that there was town halls that were being put on by the NPA about legislation. And it was a way to sort of elicit some feedback from the members about this legislation that was going to be introduced into the legislature. So it was at that meeting that I met someone that I consider that is a mentor to me. And I met some nurse practitioner friends that I sort of instantly connected with. And it was from there on that my mentor basically dragged me and said, you're coming with us. Mm-hmm. And I said, "Oh, okay. That's fine. I guess I'm along for the ride." And it was that experience that I was able to really get involved, right? So, it was from these town halls, I was able to connect with other members. And then I started getting involved in the legislative pieces, right? And understanding how bills become law and all that whole legislative process, which I will admit, I was wholly unaware, right? Mm-hmm. Like, I knew, and it's funny, in my health policy class that I still teach today, I play the Schoolhouse rocks, how a bill, I'm just a bill, bill becomes a law.
I like that.
I love it.
And because it just gives a good, picture. Now,
yes, it does.
It's complicated, and it's rare that a bill is introduced and comes out of committee and is voted on the floor and is passed and then is signed by either the governor or the president. But at least it was a good sort of, reframing of like civic knowledge of what we should all really know. So it was from there. And then, it was suggested to me, like, why don't you become involved as a membership chairperson of the organization? And I did. And then I started going to board meetings because it was an invited board role. And then I ran for treasurer, and then I ran for president-elect. And, the rest is kind of history from there. But when I was president-elect, we found ourselves as an organization that our prior executive director left, and we were in need of having an executive director. And it's really a difference from being on the board as a volunteer that is supposed to think like big picture, right? Board work is strategic work. Mm-hmm. To going to the operational side as an executive director, doing the day-to-day. Mm-hmm. And, I did have a little experience with sort of day-to-day operations because there was a time that I was involved with. Minute Clinic was the CVS health convenient care. Mm-hmm. So I was heavily involved with that at one point in my life. And from an operational perspective, I understood profit and loss statements and, policies and procedures and all things like that. So when this vacancy came up at the Nurse Practitioner Association, I put my name in the hat and I said, I'm interested in doing this. And the board at the time, interviewed a number of candidates. I had some knowledge of what was going on at the time. And, I think, that was an advantage for me. And I was hired as the part-time executive director. And I always laugh at part-time because it's a part-time role, but a lot of times it takes more time. But again, it is something that I really enjoy doing. And I don't like think of it as, work per se.
It's so good.
How do you fit all that work into do you work in a practice? Like, what do you do otherwise?
So my main job is at Columbia University School of Nursing.
Okay.
I'm Associate Dean of Clinical Affairs and Associate Professor there.
Mhm.
And my primary responsibility there is I oversee our faculty practice.
Okay.
So we have a primary care faculty practice, and I do big picture type of planning for that practice. And we have a practice manager who does the day-to-day.
Mhm.
I have the practice and clinical simulation are the areas that fall under my division.
Okay.
So, because of that, I'm in a lot of meetings a lot of the time. But again, it happens to really overlap a lot of the work that I'm doing. So, I do miss the clinical piece. I am not currently seeing patients, but I am always consulting with my colleagues and, going over, some scenarios of patients that are being seen at the practice. But I keep saying, like, each semester that comes up, I'm like, I'm going to see patients. And like, I get like 10 times more busy, like all of us.
Right.
We're all busy, but it
Yeah.
just so happens that like I couldn't even dedicate right now 4 hours to trying to see patients. And I do miss it. I do miss it, but it's just, I think just because of everything competing other interests, it's just hard to, be dedicated to that and, follow up and do all the things that we know that we have to do as a clinician. So.
Right. Oh, how long is your term as an executive director?
So it's a hired position, and it's however long that they will have me.
Okay.
That
great.
was I'm coming up on 10 years.
Oh, wow.
I'm doing it. Yeah, I know.
That's awesome.
Yeah. So I'm coming up on 10 years with that, and it's been really, really it's been great.
That's great.
So, Stephen, what are some important advances or changes happening now on a state level or even a national level that NP should know about and that maybe they should get involved in?
Yeah, that's a wonderful question. And, if I could tell every nurse practitioner out there, they should join their state organization, their state NP organization, as well as their national NP association, which is FAANP, right? And then there's all of the specialty organizations that are out there too, right? And it could be overwhelming. And you say, how and why? Why am I going to use my hard-earned dollars to support this organization that I may or may not get a lot of benefit from? Well, I'm glad you're asking what the value is.
Good question.
I want to know.
Right, exactly, right? So when we are talking about legislation, state legislation and licensure laws, that happens at the state level. And more often than not, the state NP organization is very aware of what those issues are and either has legislation that they're trying to get introduced or is working on legislation that has already been introduced to try and get it over the finish line. And that's why I think from a state level, it's really important to get involved. And, I think there's also the opportunity to not just pay your membership dollars, but understand what's going on from a professional practice perspective. I mean, at the end of the day, we are RNs first, right? We are nurse practitioners. We pay our money every registration period.
Right.
And we are held to the standard of what is in the Board of Nursing and what's in the laws for our profession. And I will say, shame on us if we really don't know what's in there or what's not. Now, practice is complicated, right? And there's a lot of gray areas, but we should have an understanding of what it is we do and what we can and what we can't. And if there's something we can't do, and it's something that we've been prepared and educated to do, well, why can't we do it? So usually we have to look at from a legislative perspective. So maybe it's a law that was written, or maybe it's an old law. So where we are in New York State is this. The law that passed in 2014 was called the Nurse Practitioner Modernization Act. And this was a law that for the first time would allow nurse practitioners with greater than 3,600 hours of clinical experience in the state of New York to no longer have a written collaborative agreement with a physician. Instead, they can opt to have a collaborative relationship with a physician or a hospital. So really for the first time, it said that these experienced nurse practitioners don't need this written agreement. So that was what we were working on for a long time. And I will say that wasn't everything that we wanted to go around and to pass, but that's what we thought we could get at the time. So it did pass in 2014. It became effective in 2015, and it had a sunset attached to it. And a sunset date is when, if the legislature doesn't do anything to extend the bill, then it would go away. It would go away and revert to the way it was back in 2014. Well, we didn't want that to happen at the Nurse Practitioner Association of New York State. And we thought that this was an opportunity for us to actually make some enhancements. We have an ability to make it permanent, but to also make some enhancements to it. So that sunset date happened to be June 30th of 2021. And what happened, what was happening in June of 2021, but, a pandemic. And it so happened that the legislature did not let the law expire. They extended it one more year.
Great.
So as of today, and I'm going to say it's January, right? Late January, early February. Nurse practitioners in New York State still can practice under the Nurse Practitioner Modernization Act, but that sunset date is on June 30th of 2022. We need to get a new law passed. An amendment, an amendment to the Nurse Practice Act is essentially what we're doing or trying to do. That would make the Nurse Practitioner Modernization Act permanent and would also eliminate that language of the collaborative relationships and just make it clean. So nurse practitioners with less than 3,600 hours still need a written agreement. And we could talk for a long time about the concept of transition to practice and whether those transition hours should be a thing or not. And there are states that have 0 transition to practice hours. There are states that have, 2 or 3 years transition to practice hours. And, that's somewhat, controversial. And the reality is there's really no evidence to say what should that time be, if anything. But again, in New York, we're hoping that this new law that will pass is the less than 3,600 hours still have a written agreement. But after you hit that 3,600 hours, you can practice at the top of your license, which we have to do already, right? But we need this mandated relationship. Without that relationship, technically nurse practitioners can't practice. What I always found odd about that concept was nothing really changes if there's a collaborating physician or not, right? Like we have a network of colleagues that, I said this earlier, no one knows everything.
Right.
And hopefully you are reaching out to your colleagues who know in X area that this is how, I have a question or this is an odd reaction and I can speak to my colleagues about that. But, and that's what we do as professionals, right? That's what I would hope any professional would do when they came across anything that they didn't know. But when that is mandated in law and I can't practice at all without this component being there, then that's a problem because nothing really changes. I mean, I've heard stories, right? When I went to those town hall meetings and I was listening to why this law should be passed in the first place. And there were nurse practitioners in rural areas of New York State. A lot of times we think of, the city for New York, but there's a lot of rural areas of New York State. And there were nurse practitioner practices that were the only primary care game in town. And they were paying their collaborating physicians, whatever it was a month, just for the ability for them to stay open. So they could just see patients, right? Well, it happened that those nurse practitioners, their collaborating physician came to them one day and said, I took a new job and I can't collaborate with you anymore. I'm sorry, I have to rip up our written agreement.
Wow.
Well, at that moment in time, those nurse practitioners could not see a patient. Like they could be accused of professional misconduct because they didn't have a written agreement and there's no grace period. Like if at the time you didn't have a signed agreement with a physician, you can't see a patient.
Right.
And it doesn't matter that your schedule for that day had 25 patients on it. You couldn't see a patient without that written agreement. So it really didn't make a lot of sense.
Right.
And it was those stories that really, prove that point as to why these laws need to change and why we need to sort of modernize those nurse practitioner laws.
Wow.
And that's all at the state level, right? So, every state, now there are some states across the United States that have full practice authority. These are nurse practitioners in their Nurse Practice Act do not have this regulated agreement with a physician. And I always point to the map that FAANP puts out, and they have this map that shows green, yellow, and red. And the states are green for full practice authority, yellow for reduced practice authority, and red for restricted practice authority. And the yellow and the reds, means that there is some physician involvement from a licensure perspective, that you can't do what you've been educated, taking board exams, right, taking your national board certification test to do, unless you have something in place that allows you to practice.
Right.
So that's going on in all those other states. And then you mentioned about like at the federal level, and then there's Medicare law, and that's at the federal level. And there are many things that are going on that has to pass Congress and has to go through Congress and be signed by the president in order to change. And one of the recent changes was back in 2020, the CARES Act, for the first time, allowed nurse practitioners to order home care services. Because prior to that, nurse practitioners were not recognized by Medicare to perform the face-to-face visit to order home healthcare services. And I've always thought about, when we talk about home healthcare services, we're largely talking about nursing services.
Exactly.
And if nurse practitioners can't be the ones to order nursing care, what is wrong with this picture?
Yeah.
But it came down to is that technically we could order home health care, right? There was no state law that said really nurse practitioners can't order home health care. The problem was that the home health agency that is billing Medicare would not get paid by Medicare if the order was written by anyone other than a physician. So for the first time that changed, and that's not, it was like happened overnight. There were bills in Congress that had been introduced and were not passed years and years and years.
Wow.
And finally, this was an opportunity to put it in the CARES Act and make it law. And now I say this with, there's always an asterisk when you talk about state law and rules and regulations, but generally speaking, nurse practitioners now across the United States can order home health care services, and Medicare will pay for those services.
So good.
That's awesome.
We ran into that discussion when we interviewed Wendy Wright. Are you familiar with Wendy?
Oh, yes.
Mm-hmm.
Oh, yes. I know Wendy well. Yes.
Yeah. So when she said that when she started her practice, that she had to hire a physician to order healthcare, nursing care, and also durable medical equipment.
Yeah.
So she paid somebody on retainer who would write the prescription so that she could provide that for her patients, which was so interesting.
And with that, we're talking commodes.
Yeah.
We're talking walkers.
It's it's silly. It really is. It's just silly.
Right. And there is one other barrier that exists. And I tell this story, and it is diabetic shoes. So right now, nurse practitioners cannot order diabetic shoes for patients because Medicare will not pay for it. And this is an issue that has been longstanding. I have gone with FAANP to Washington, D.C. We do our health policy conference every year, and we go to meet with our senators and our congressmen and women, and we talk about diabetic shoes. And I'll never forget, there was this congressperson that I was speaking with, and he said, "Are you really talking about shoes?" I said, "Yes, these are shoes, and the reason why we order shoes for patients with diabetes is because neuropathy, and they lose feeling in their feet, and they are more prone to circulation problems." And I went through this whole pathophysiology thing, and he was just said, "This is a no-brainer." He's like, "This is a no-brainer."
Good.
It is a no-brainer.
Yeah.
Yet, here we are in 2022, and nurse practitioners still cannot order diabetic shoes for patients with Medicare, right? Like Medicare is the sort of qualifying factor. Now, it's most likely that patients that will need diabetic shoes are older and will have Medicare. So that's a big deal, right? So that's one of the issues we continue to work on at the federal level. And again, I urge anyone listening to this, there is a bill called the Access to Diabetic Shoes Act that is in Congress, and we should all be writing to our legislators and asking them to support this because it truly is a barrier, unnecessary barrier to care for the patients that we're caring for.
I just have one more question.
Sure.
And it goes back to the 3,600 hours. So I work per diem as a nurse practitioner. I'm a clinical researcher in my primary role. And I've done that for a long time. But I keep working as a nurse practitioner in order to keep up my license. But what I don't really understand about the 3,600 hours is who's keeping track of that? Like, how am I proving that I had 3,600 hours and now I can hang my own plaque?
Yeah. So in New York State, the language they used is it's an attestation, and you are attesting that you have 3,600 hours. And there's a form on the Board of Nursing website that says, put your initials here. I attest I have more than 3,600 hours of clinical experience. And, you go through down the list and you initial it. And then you take that form and you file it away in your file drawer. It does not get submitted to New York State. But if there were ever to be some question, right? If somebody ever came knocking on your door and said, prove that you have 3,600 hours, I mean, at that point, you would show your CV, right, or your resume and show your work history and say, here's my 3,600 hours. I mean, nobody, at this point is calculating, the hours you work per week, and 3,600 hours translates to just under 2 years of full-time work. So if you've worked full-time, and you could get to those 3,600 hours anyway, right? Like whether you worked, 40 hours a year, right? However long it takes you to get to 3,600 hours, then as long as you hit that threshold, you're allowed to practice without that written agreement, but maintaining that collaborative relationship.
And there's clinical hours, correct? It's not in a leadership role or something.
Correct. It's clinical hours with the thought that you're providing some, clinical care, right? And it could be telehealth. It could be, all different models that we see now. It doesn't have to be a traditional practice, but they need to be clinical hours.
Gotcha. Thank you so much for that. I'm hoping that there's some other people out there who have the same question.
Absolutely.
Oh, I'm sure.
So earlier we were talking about how as a nurse practitioner, your scope of practice and what you're allowed to do does depend on, state to state and what they allow you to do. What are your thoughts on Nurse Compact Acts and where is New York in that process? What are your thoughts? And maybe you can even start out by defining what is compact.
So the idea of the compact is there are a number of states that agree that from a licensure perspective, the licensure is portable from state to state. And it doesn't mean you can just pick up and go to another state and start practicing. It just means that you can apply to that state board of nursing without sort of that initial application and starting from scratch. If you're licensed in one state, the other state recognizes that state you're coming from and says, okay, we'll grant you a license, right? So there are a number of states, and from an RN perspective, there are a number of states that have this compact. And it has to be written into the Nurse Practice Act. It's a law in order to be part of a compact state. And it's something that generally works well. New York State is not a compact state, although there has been language that's been introduced that would allow New York State to participate in the compact. And certainly because of COVID and, needing out-of-state resources and support was one of the factors that, helped to bring this forward. So because you can't just pick up and go to another state and start working, right? You need to be licensed in that state and follow the rules and the regulations of that state. And that's where telehealth has really made things very complicated because you may obviously be physically located in one state, But via telehealth now, that patient could be anywhere that they have an internet connection, right?
Mm-hmm.
And you need to follow the laws in the state that the patient's in. Otherwise, again, you could be practicing a profession without a license in that state. So RN Nurse Compact makes a lot of sense, again, because nurses' scope of practice at the RN level is pretty interchangeable from state to state. The problem comes from the Nurse Practitioner Compact, and there is no Nurse Practitioner Compact yet. A certain number of states would need to pass legislation in order for the compact to go into effect. But here's the problem with the Nurse Practitioner Compact. The way it's currently drafted is that states need to have, and I'm not going to say the number of hours because I don't know the exact number, but states would need to have X number of hours of transition of a nurse practitioner before they could practice autonomously.
Oh, wow.
The problem is that what happens in the states that have 0 hours and don't require transition of practice, if those states became part of the compact, they'd go backwards and say, if we're part of the compact now, we have to have X number of hours. So the current nurse practitioner language in the Nurse Practitioner Compact is problematic. Mm-hmm. And there have been some forums, there has been some opportunities to talk to the National Council of the State Boards of Nursing, because these are the folks who sort of propose this information and try and get that information to be in sync with what's going on across the United States. So RN Compact, good. Nurse Practitioner Compact needs some work so that we can, not go backwards in any way.
Right.
But I think from a concept, again, we don't have national licensure, right? Mm-hmm. And I think that concept should apply. Like, why do you have all these rules in one state and different rules in another state when we have been educated at the same schools, we've passed the same national board certification exams, but literally what you can do changes based on the physical location that you're in because of that state law or that state regulation.
Wow. So nurse practitioners are very busy. They have very hectic lives, not just professionally and personally. What are the benefits of being a part of the Nurse Practitioner Association? Like, why should we become a member?
Yeah, it's a good question. And it's one of those questions that keeps me up at night because, again, what is the value to become part of an organization, right? Well, I'd like to think an organization has, colleagues that are in similar situations, possible mentors that you can help identify, right? And work with you. There are, all associations to some degree have member benefits that are exclusive to the members of that, organization, whether it be discounts on continuing education or, other types of things. But, I keep coming back to the legislative piece. Mm-hmm. If you encounter a problem in your practice and we identify that it is a state law that prohibits you from doing said issue, get involved with your state organization and, try to help influence that agenda. Because look, we can't go to the legislature every year to our lawmakers and say, here, we have 50 things we want you to fix this year. That's just not going to happen, right? So we have to prioritize what makes the most sense. And the board of directors does this, right? So it's conversations. What's affecting the most people? What's affecting the most patients? And how can we come up with a solution to fix it? So, I think that's really powerful that, you could bring a potential issue and get it potentially fixed in state law. And I think that's really powerful. Yeah. But, I don't want anybody to think it's all about legislation, right? It's because it's not. That's a small part. It's a significant part, but it is an opportunity for continuing education and networking. I'll also won't forget, as a member, I've gone to many a meeting. Each region has their own, monthly meetings and whatnot. And I remember going to those meetings before I was involved at the level I am now. And people would say, oh, there's a new job opening up in the, such and such department that I work in. It's not posted yet, but I want to let you all know about that. Mm-hmm. I mean,
That's good.
to get jobs,
Yeah.
we know how difficult it is to get the right job, right?
Right.
And to be able to hear that and know that of an opening that's coming up, it just helps you network and perhaps get your resume seen before it goes into that, electronic database of everybody who's applying to that position. I think that's really powerful too.
Yeah.
Absolutely. There's also mentors, ability to find mentors and preceptors, correct?
Absolutely. Yeah. So we have a preceptor finder at the state level. And, this is one of the big issues in schools today. And it's one I take issue with as well. Schools need to find preceptors for their students. And
oh my gosh.
this is one of those issues that we could probably spend hours,
Yes.
days on.
So true.
But there's lots of reasons why we don't have good, like, one-to-one, right? Like, we don't have a pathway for every NP student to have a preceptor. But we do offer this, service as part of your membership is to sign up, and we send out blast emails, blast messages to our members in geographic regions throughout the state and say, hey, we're looking, this student is looking for a preceptor in primary care in, Buffalo. And it expands that networking for people to hopefully get a placement. And that is a big issue.
Okay. And you said that's sent via email?
Yeah, that's usually blast message, via email. And look, here's another challenge, right? We're all inundated with email, right? Like,
Right.
Who wants to read all these emails? So, we are at, the association level. We're doing more with social media. We're doing more targeted, so members understand what they're getting for their membership dollars, and just trying to broaden the message. So that will be coming. But primarily speaking, for the preceptors, we've been blast emailing, like, based on their geography and based on their need.
Gotcha.
I would have loved to have seen that. I don't think I was a member of the NPA when I was in school. Yeah.
See, and there's a student discount.
There is.
I realized that.
And students really, it's like a third of the cost to join as a student. So it really, students may think, oh, I'm not an NP yet, I don't need to join your association. And we say, no, now is the time,
Right.
because there are so many benefits. There's a transition guide that we update all the time that, it's specific for New York State. Like, these are the laws. This is what you need to do after you graduate to be able to practice in the state of New York. So, and we have a consultant that any member could email and ask their specific question and get that question answered in a really, really quick turnaround.
That's great.
It's great.
That's really good.
And there's, when you become a member, there's obviously different levels of commitment. You said that there's monthly meetings, but I mean, if someone wanted more of a commitment, are there opportunities for that?
Yeah, that's a great question as well. Yes, there are lots of opportunities to become involved in the organization and the governance of the association, because that's what board positions are. So each region has its own board. So there are 7 boards throughout the state, and they all need a president, a treasurer, a secretary. They all need meeting coordinators and membership coordinators. So maybe you don't want to go all in yet. Maybe you want to say, oh, maybe I want to help, but I don't want to help all that much. So, there are ways to volunteer and get involved and say, hey, I know a lot of connections in education. Maybe I can help put together some of those monthly education meetings. And that's a good way to get involved. But, I truly believe that there's something for everyone. And if you want to be all in, you could be all in and get involved. But if you only want to just read the emails and follow the social media, you could do that too.
Fantastic. Awesome.
That's a nice opportunity.
Yeah.
Yes. And at the end of the day, we are, again, doing a lot of the lifting for all nurse practitioners in New York State, right? Of course, not every nurse practitioner in New York State is a member of the NPA, but everybody benefits truly from the work that's being done. So,
absolutely.
I think in the grand scheme of things, membership is so important.
I have a quick question. I know I'm jumping over someone, but if I have an issue as a nurse practitioner, what is the process? Who do I contact? how do I start that ball rolling as to getting help from the NPA?
So if you are a member of the NPA,
as
you
a member,
could,
yes.
yeah. And again, this is one of those member benefits, right? So
Yes.
if you're a member, you could either call our office, and we do have a full-time staff that answers the phone, and sometimes they can answer your question for you. If it's a professional practice question, they'll send it to our consultant, and depending upon the urgency of that question, could either get back to you by phone or by email. There's also, on our website, we have frequently asked questions and that guide I mentioned. So you might be able to find that answer to that question on your own, because it's likely somebody asked that question in some way, shape, or form before. So
thank you.
You're welcome. And we're on social media too. So, if you have a question and, you're on Twitter, you're on Instagram, you're on Facebook, you can send a message and it will get to the right place in person.
That's really good. Thank you.
You're welcome.
How often are your elections, if we wanted to, for anyone who would want to become more of an active member of the NPA?
Elections are yearly.
Okay.
And towards the beginning of the year, there's a call that is put out for what positions are up for election, and defining the whole process of, what positions are up and what the requirements are and the nomination process. So, be on the lookout for that. We typically do our state elections. It coincides with election day. So, we announce it in February. So our president's term, it's a 3-year term. So there's president-elect, president, and past president. So that one person will go through all those in succession, right? So you're president-elect and you're mentored by the president, and then the president goes to past president and you become president from president-elect, and then we bring in a new president-elect that gets mentored. So that's the process. So every year we're recruiting for a president-elect. So that's at least one position that's always going to be up.
Okay.
Here's an important thing, and depending on who you are board certified with, if you are board certified with ANCC, your volunteer work can count a certain number of category for your national certification every 5 years. So it's professional development, and not a lot of people know about that, but it's not just, contact hours, of course, has to be a part of it, but there are also opportunities if you have a certain number of publications, those can count a category, or if you teach. So there's lots of categories, and I would certainly urge people to look into that, because, yes, it's a volunteer, but it could help you and your national board certification requirements as well. So that's a nice perk.
That's great. Thank you.
Stephen, thank you so much for just sharing just the wealth of information. It's been really informative. I know for me, even motivational I'm actually in Colorado now. So I'm I need to get myself moving on the board here and see what's going on as far as, some of the issues going on.
Yeah.
But I did want to ask you one final question. So with the wealth of knowledge you have and what you understand now as a nurse practitioner, what do you wish you knew as a student nurse that you could kind of give some encouragement to some of the students out there?
I would say to reach out for help. And I think people do that better these days than back when I was a student in school. And I think you just have better access to people because of social media and, networking at conferences. So, don't be afraid to reach out. Know that some people are really busy, and you may reach out to them and they may say, I really can't help you, and that's okay, but reach out to somebody else. Don't let that encounter sort of cloud your, vision and say, oh, well, I reached out to somebody and they were too busy. And no, we're all have tremendously busy things going on outside of our professional lives. We have personal lives and things are going on. So use that network, ask for help wherever and whenever you can. And really, don't think of this profession as only being clinical. There are so many opportunities to do different things. We know our healthcare system in the United States is broken. We know that there needs to be solutions. And I say, why shouldn't nurse practitioners be not part of those solutions, but why aren't we coming up with those solutions and implementing them?
Right.
So I think, the world is truly your oyster. There are so many directions one can go in, and, always remember there's a patient that you're caring for. And just like we have incredibly complex and busy lives, our patients do too. So, I think being grounded and being aware of all these dynamics, helps to make us good clinicians, and be part of the healthcare landscape that is making a difference in the lives of our patients and in our community. So I would encourage those to continue on and try and stay as positive as you can.
Very, very good. Thank you so much for that.
Oh, you're welcome.
Wow.
Are you, well, I know you all started in New York, right? Like you have New York connections?
Yes.
Yep. And then a couple have branched off. We missed them.
Flown the coop.
Yeah.
Christina and I are both still in New York.
They left us behind.
Yep.
I'm in Florida.
And Alicia's up in the mountains.
Got it. Well, Colorado's a good state for nurse practitioners. And Oneida, you're in Florida?
Correct.
So Florida
It's coming up. It's trying.
They're trying.
Change.
Yes. They are trying.
exactly.
That's why you're there.
They need a little bit more help, but they are
Exactly.
on a good trajectory.
Yeah.
You need to run for president-elect for the Florida NPA.
I could totally see that.
Yeah, get on that.
Yes.
I'm on
Let's
it.
get you involved. Come on.
Thank you so much. It was awesome to hear your story, and thank you for everything that you do. I know that our lives are better because of everything that you guys do.
Yeah.
Thank you. I do appreciate that. I know that on a Sunday you could all be doing something much better than this, and I appreciate
we love
the work
this.
that you're doing and getting out there. I love it. I've followed you pretty early on when I first saw your Instagram and listened to your podcast.
Nice.
So good luck to you.
Thank you.
I think this is really important work as well. So keep on keeping on.
Thank you for listening.
FAANP's podcast has a Facebook group called Nurse Business, a community created to support one another and enjoy positive ideas and thoughts. We hope you'll join us. In addition to that, for a little fun, follow us on TikTok.
Subscribe to our YouTube channel to see some clips of our live interviews and listen to past episodes. Feel free to email us with ideas for episodes, comments about our podcast, to recommend an interviewee, or if you'd like to be interviewed yourself at 4npspodcast@gmail.com. That's the number 4npspodcast@gmail.com.
Please follow us on Instagram, Facebook, and Twitter at 4NP's Podcast. That's the number 4NPS Podcast. Subscribe to us wherever you get your podcast, and go to our website at 4npspodcast.com for episode transcripts, resources, and more information about us.
Please join us for our next episode where we speak to urology nurse practitioner Alexandra Yako. She is absolutely amazing, and we can't wait to share her journey with you all. The information in this podcast is for educational purposes only and should not be used in substitute for professional care by a medical provider. The information in this podcast does not represent medical or other professional advice or services. The thoughts and opinions presented on the 4NP's podcast are of the hosts and guests and do not represent those of their employers.